Hello everyone, we are pleased to share with you another edition of the Week in Review, this time with focus on Budget Presentation 2025. With Guyana's largest budget of $1.38 trillion, parliamentarians met last week for the 2025 budget debate. During his presentation, Honorable Minister of Health Dr. Frank Anthony highlighted significant developments within the health sector, which he said his administration has prioritized. He outlined key advancements, including the expansion of facilities and improvements in primary health care to meet the growing needs of the population.
In the last 3 years, Mr. Speaker, 3 years, we have built 25 new health centers and health posts across this country. You come and said you want to train community health workers. When we came here, many of the facilities have no community health worker. Under this government, more than 500 community health workers were trained.
The minister also emphasized plans to increase access to essential health services with a focus on strengthening healthcare delivery, as well as initiatives to recruit and retain more healthcare professionals across the country.
Mr. Speaker, they talk about nurses. Who you think increased the salary for the nurses? The People's Progressive Party increased the salary for nurses. And right now, we have 3,000 and more persons who would be graduating soon from nursing, assistant nursing program, and others. This year, we are also going to take in another 3,000 people.
The Honorable Minister of Health further underscored the government's commitment to improving the quality of healthcare across the nation. He highlighted the ongoing construction of new hospitals and health centers, the upgrading of existing facilities, and the continuous efforts to equip healthcare workers with the necessary training and resources.
In another couple of months, Mr. Speaker, 6 new hospitals would be open. 75 beds each. 75 beds each we will be adding. And when we finish there, we have the Ogle facility, 252 beds. You have New Amsterdam, 240 beds. You have West Demerara, 220 beds. And then all the hospitals, Maruka, another 50 bed. Lethem, another 50 bed. Keto, another 50 bed. This is our record.
In his address, the minister also pointed out the decrease of maternal deaths under the PPPC administration. Dr. Anthony had this to say.
Let's talk about maternal deaths. 2017, maternal deaths in this country was 23. 2018, maternal deaths 20. 2019, 23. 2024, Mr. Speaker, it was down to 14. That's our record. And 2 of those deaths were deaths of Venezuelan migrants that crossed the border, came to Region 1. We medevac them, brought them to Georgetown, but unfortunately they died. Every mother that died is something that we mourn. It shouldn't happen. But we have reduced maternal deaths in this country because of the investments that we have been making.
Furthermore, Minister Anthony firmly stated that the 2025 budget caters for everyone, including adults and children, those living in the hinterland or coastland, and those employed or self-employed with the private or public sector. This brings an end to our Week in Review. Thanks for joining us and stay tuned for more updates.